Hi, Dr. Sandeep. Could you please tell if all breast lumps mean breast cancer?
Breast lumps are very common, and most of the breast lumps are not cancerous. Now, there are many causes of breast lumps. Like most common cause of breast lump is a cyst in the breast. Cyst actually means a fluid-filled cavity. There is water or fat inside it. It just accumulates. It can grow. It can, bulge your breast. But these are not of any concern. In fact, we can even put a needle into them and remove the fluid, and that should solve the problem in many cases. So it is not a great concern. There are other types of breast lumps called fibroadenomas, which are very, very common among younger age group. Like it's a type of tumor, but a benign tumor which does not harm. It usually occurs in 20 to 30 years of age group. Now these tumors can most of the times be left alone. Very rarely there are indications to operate, which we'll be covering in our subsequent videos. There are other lumps, like the painful lumps, like the fibroadenosis, what is a formation of a multiple cystic lump in the breast, which is a problem with the gland, breast gland. These are quite painful to the patient. The breast feels very, very lumpy, but again, these are not of concern. They don't cause any cancer. They are just there. They are hormone dependent, and they tend to be there, and they tend to be there for lifelong. There are other lump forming entities in breast called mastitis, where there is some kind of an swelling, there is an infection like a state in the breast. These are also painful. They tend to be cyclical. They tend to come sometimes and vanish sometimes. They are not always there, but when they come, they can be painful. Sometimes these are hormone dependent as well. There are other entities which are associated with the breast duct itself. Breast is a secretory gland, which means it secretes milk. So there are ducts, the channels which convey the milk from the gland to the nipple. Many times there are diseases associated with these ducts. There is something called duct ectasia. Now duct ectasia the duct is simply swollen. It is very wide. So these wide ducts tend to secrete, they tend to cause some problem or the other once in a while. And these wide ducts sometimes can even cause bleeding, and they sometimes can cause infection. So these are also felt as lumps in the breast sometimes. There are many other causes of lump in the breast which are not at all bothersome. They may bother the patient, but they don't really cause any cancer or they don't harm the person. There is another entity called fat necrosis of the breast, which is because of an injury. Something hits the breast and there is a hard area which feels sometimes painful, which can even confuse a doctor. Sometimes we think it is cancer because it feels very hard. But these are just, injured fat tissue, which resolves by itself. So these are some of the very common confused causes of concern for the patient when they come running to the doctor, which are actually not problems. But again, I want to warn here that any lump in the breast has to be investigated thoroughly by the doctor, because it is okay if we diagnose it as benign disease, but we should not miss a cancer. And missing a cancer can mean, it will spread and it will cause more damage. So any breast lump has to be investigated thoroughly.